So let's talk about HIV, and you've seen it's covered in this today's papers, especially the Standard has page 2, 3, and 4. Today is World AIDS Day. The National AIDS Control Council is going to be releasing a report, which is already being covered in part sections of the newspaper. Women bearing the biggest AIDS burden, and especially looking at the shock because teens and young adults are topping the new HIV infections countrywide. We just briefly looked at it in the earlier hour. The ages of 15 to 19, new infections 6,247. This constitutes 15% of new infections in total. The age of 20 to 24, now between 15 and 24, these are high school and university and college students. Age of 20 to 24, 8,181 new infections. That's 20% of new infections. Age 25 to 29, 6,976 new infections, 17% of new infections. Now, this is the highest. This is saying something. And then also we're looking at now those that have access to ART, that's antiretroviral treatment. 500,000 of the infected adults are not on ARTs, and 72,000 infected children, that's accounting for 30%, are also not on ARTs. A number of things to consider. Now, the National AIDS Control Council is launching this and other initiatives today. Ndu.
Yeah, so we're looking at the launch of a strategic plan for the next 5 years to, basically roll out the response to HIV over this period of time. And exactly what are the responses going to be? How are you going to be able to deal with this? The numbers that we're looking at seem to have been, instances that would have been forgotten in the past. But we're looking at 57 every day, 57 new cases.
Deaths, huh?
Yeah, cases of death with HIV every day. 20,000 deaths so far with HIV, from HIV, and we're looking at 1,400 from COVID, for example. So just to say that, there's still other problems in terms of deaths from disease that we see in this country. So we're going to have a conversation about this morning, and joining us is the head of strategy development from the National AIDS Control Council, that's Geoffrey Obonyo, who's going to give us some of this data and how we can actually look at this this morning. Geoffrey, good morning and welcome to the Situation Room.
Good morning.
Good morning, Geoffrey. Welcome, and thank you for for joining us today.
All right, so Geoffrey, we're looking at these numbers today. I mean, this is all going to be launched today. Give us a footprint of what's going on in the country as per HIV/AIDS so far, and what we hope to achieve going forward with this new data.
Okay, thank you very much. So today we're having the World AIDS Day. This is a day that is celebrated globally, and it's meant to remember our brothers and sisters who have died of HIV and AIDS, and also it's meant to raise awareness about HIV and AIDS, and more importantly, we show our commitment and unity in supporting the people who are living with HIV and AIDS. So that's why we are having the World AIDS Day today, and so the global theme for this event is global solidarity, shared responsibility. And we have customized this global theme to fit our Kenyan situation, where we are saying commercial HIV and COVID-19. And the reason we have chosen this theme is given the fact that we have seen COVID-19 is a major public health threat that has a potential of eroding or reversing the gains that we have made in the HIV response over the years. And for this reason, that's why we have that theme. So I want to give you an overview of the HIV situation in the country. Now, currently, we have 1.5 million people who are living with HIV. Now, out of these 1.5 million people, we have put on treatment 1.16 million people. These are the people who are on treatment programs, receiving treatment from the government initiative. Then we have still a significant number of cases we call new HIV infection cases. There are 41,000 cases annually. Then we also have HIV related deaths that are 21,000. And as you have rightly said, out of the new infections, we are having the age group of 10 to 19. We're having 15% of them getting new infections. And then we are having the age of 10 to 19, that is 15%. Then 15 to 24, they are about 40% of new infections. And that's why in this World AIDS Day, we are launching our Kenya AIDS Strategic Framework, which is the leading policy framework that guides the country in the HIV response. Yeah.
Sorry, go ahead, please.
So basically, that is the overarching policy framework for the HIV response, which then will be implemented by all actors in the HIV response, including the county government. And that's why in the same launch, we're now launching the specific, a county-specific plan where this event, for a county where this event is being held, that is Kajiado County. We are holding the national event in Kajiado County, and we have done a specific plan now that is tailored to meet the needs of that county. Thank you very much.
Thank you. Now, with the activities that you have planned, and the activities that are planned every year with the World AIDS Day, what exactly do we hope to achieve with these activities?
Well, the main aim of the activities that we plan, they are in line with the theme of that year. But first of all, we want to raise awareness about the HIV situation in the country, and also showcase the initiatives that we have in responding to the HIV situation. What are some of the innovative ways we have to have our population access HIV services? So those are some of the initiatives that we showcase.
What are some of these innovations, Geoffrey, that you've talked about? Innovative and creative ways to make the population then access some of the services that they need for HIV. What are some of those things?
Some of the innovative ways, for example, we are launching the HIV self-test kit, that we have a machine that dispenses these self-kits, which basically you serve yourself like an ATM machine. So basically, it's a machine that you access and receive the self-test kit, and you're able to test yourself. And in that way, we will have more people who know their status. If you find yourself, you are HIV positive, you go to our facilities and you're put on treatment and care. And so in that way, we'll be able to bridge the gap.
For the longest time, when people were tested for HIV, one of the things that was done is they were counseled. So if we are going to have this innovation, which in and of itself I believe is good, are we saying that we're dispensing, are we doing away with the counseling element in HIV testing?
No, the counseling element is still there. So HIV testing services are still ongoing, but these are additional initiatives to increase knowledge of the HIV status. As you understand, we having in treatment, we're having a cascade where we want to have at least 90% of the HIV people in the country know their status. So we want to make sure that we reach that target. So it's meant to bring more people on board, but the counseling services that are associated with HIV testing and services are ongoing.
Okay, when you say they are ongoing, and let me ask the question. Would you say that anyone in this country who would require a test is now in a position to actually get the test wherever they are?
I would say yes.
Mm-hmm.
Yes.
And do they also have the services that correspond to the testing? Because after they've been tested, they have to go through the adherence counseling and all these processes that they go through. So you're saying, and thereafter, they will need an administration of ARVs. Are you saying that these services are available throughout the country?
Yes, they're available in most of our health facilities.
Then if that is the case, then why then do we report that we still have cases of people who are HIV positive, have tested positive, and yet are not on treatment?
Why do we have people who have tested? That's why, we have reported that we out of the 1.5,
yes,
only 1.16. So we have about 400 or close to 500 who are not on treatment, and that number is because of various reasons. So part of the people who are not on treatment, these are some of the people who have not been tested, or we don't know their status. Then there are also those people who don't have the right information. That's why we are launching this strategic framework, which outlines strategies on how we are going to communicate so that everybody has information and they will be able to seek appropriate services.
So are we saying essentially that anybody who it turns to be HIV positive today will then have access to the treatment that they need? We understand that it's a process, that you don't get tested positive today and then you get on treatment tomorrow. We understand the process. But are we saying that through the process, if someone is found to be HIV positive in the country today, through the process, everybody then will have access to the treatment that they require?
Yes, the treatment program is elaborate. Once you present yourself to the health facilities, you'll be guided and you'll be able to be put on treatment. Yes.
So these folks that we are seeing now who don't have access to the treatment, there is a reason as to why they may not have it. Because what we've been told is that they are positive, but they don't have access to the treatment. So there could be an underlying reason for this?
The underlying reason, I say, majority of these are those people who have who probably don't know their status or have just recently been infected. Because as you've seen, 41,000 new cases per annum. That's still a big number. And so that forms part of this population. And so as I was saying, in our strategy, the strategy that we are going to launch, CAS, we are calling the second Kenya AIDS strategic framework. We have our main objectives or main result areas. One is to prevent new HIV infections by 75%. So in the next 5 years, we're looking at ensuring that 41,000 cases we are seeing annually, like for the case of the last year, moves down by 75%. We're also saying that we're also targeting STIs, that's sexually transmitted infections. We also want them to reduce by 75%. And then we are looking at AIDS-related mortality, that is the death, which are paid are about 21,000. So these AIDS-related deaths, we want to bring them down to um, to 50%, then we're looking at stigma and discrimination, which has been a major hindrance to seeking services. And by the way, one of the reasons people don't go for testing is because of stigma and discrimination.
Yeah.
And this, like the innovation we're saying, is meant to bridge that gap. So if you fear, you don't want to go to a facility, you are able to pick the test kit and test yourself. Then the other objective is we're looking at domestic financing. We want to increase this to 50%.
So this is in 5 years. I just want to clarify here that all these things we're talking about, like reducing the new infections by 75%, is over a 5-year period.
That's over a 5-year period.
So by the end of 5 years, we'll be having a 75% reduction in new infections per year.
Yes, no, not per year. After the end of 5 years, when you evaluate from the current baseline, you would have done 75%.
Okay. So, and just to bring everybody else who is just tuning in on board, we are speaking with Geoffrey Obonyo. Geoffrey is the head of policy and strategy at the National AIDS Control Council. Today being World AIDS Day, the National AIDS Control Council is set to launch the second Kenya AIDS Strategic Framework that's going to cover 5 years, and is telling us what's going to happen. At the same time, they've released the statistics that are showing the status of HIV in the country, the number of infections per year, 41,000 new infections every year, 21,000 about deaths every year, and 1.5 million people who have tested positive for HIV, 1.16 million are on antiretroviral. I just want to come in here, Geoffrey, and ask, so before we even go into how then you're going to roll out the programs to ensure that you achieve the 75% reductions and 50% reduction of deaths, let's look at the ones that are currently, and you are responding to this, the ones that are currently not getting antiretrovirals. Close to 500,000 people, when 1.5 million people have tested positive for HIV. So I'd assume that this is not an estimation. This is the actual data that you have of people who have tested positive for HIV, and then you have that data that these are 1.5 million people who have actually gone and conducted a test, and they're on record that they are HIV positive. Is this the case?
The people, sorry, I think I've lost you, but the people who are on record are the 1.16, which is close to 1.2 million. The people who are on treatment, those are the people who are on record.
Okay.
And the 1.16 includes those people who have gone public about the HIV status, and those who are HIV positive have not gone public but are seeking treatment services.
Okay. And who are the 1.5 million? How do you arrive at the figure of 1.5 million? Is this a projection?
So the extra 400 is an estimate arrived at through modeling, given the data and the program information that we have.
Okay. So this being the second strategic framework that you're launching, I'm assuming it's succeeding a previous framework that you had launched and you had worked on before, right?
Yes.
So the previous framework, I'm sure, also had its own objectives, and it had its own metrics and targets. Can you just give us the success or the challenges that you faced with the previous framework, so then we can use that to see what it is that you're going to do different to be able to achieve what you didn't achieve in the previous one?
So I'll give the main results of the previous framework. In the previous framework, we also targeted for HIV prevention by 75%. We achieved 43% of that target. So that is a target that was not met. But we did very well given comparing that the HIV response came down by that much. That's about close to 6% of the target. Then we were targeting to reduce HIV-related mortality, that's the death, by 25%. We surpassed that target. We reduced HIV-related mortality by 64%. And then there was a target on stigma and discrimination, which basically we have not carried. We're yet to evaluate that because the survey is underway. And then we had a target of also meeting 50% of domestic HIV responses being financed by domestic resources by 50%. We are at that 2%.
Currently speaking, Mr. Obonyo, if I may ask, how much of these efforts are actually funded locally by the government of Kenya, and how many of these activities or how much of this progress is funded by friendly donor countries or agencies?
So, in terms of the total HIV response, at the current, we are receiving 32% from the government, and the rest, that is about 8, is from partners, that is external donor, external partners, and also even local partners. Partners such as the PEPFAR, that is the PEPFAR Present Emergency Program for AIDS Relief, and also the Global Fund. So those are some of the partners. But we are receiving 32% from the government of Kenya, and we are progressively targeting to ensure that within the next 5 years, because the external resources have been decreasing, we hope that as the external partners withdraw, the government steps in and takes that up, and we hope that we will be supported up to 50% by the end of 5 years. Thank you.
Well, we want to thank you very much, Geoffrey, for joining us this morning. We wish you all the best as you launch this strategic framework, the Kenya AIDS Strategic Framework. That's going to cover the next 5 years, 2020 to 2025. And also the work that you're doing in terms of addressing the plight of those who test positive for HIV, and also creating awareness for people so that we reduce the number of infection, the rate of infection of HIV. Have a good day, Geoffrey.
Thank you.
Thank you very much, sir.
This is the Situation Room, the only way to start your day.